Edo State Primary Healthcare Development Agency don Tanda Gidigba on top measles and Rotavirus vaccination. Say the vaccination go start 15 November for Edo. Edo State Primary Healthcare Development Agency don do talk with tori pipo and ogbonge pipo on Thursday on measles campaign and Rotavirus vaccination matter. Measles na disease wey na virus dey cause am and na mostly pikin e dey affect wella and con still dey cause death for pikin. Measles na disease wey dey transmit fast and na killer disease for children. Na dis one come make the Edo State government come shine their torchlight on top the matter make dem make the people for the state vaccinate their pikin. Dis one na for pikin wey be between the ages 9 months to 59 months. Dis campaign go happen for different places wey parents fit carry their pikin go and parents fit carry their pikin go any healthcare center for Edo. Dis measles vaccination na free, dem no dey collect money for am. The Edo State Health Educator for the Edo State Primary Healthcare Development Agency, Uwabo Irene, wey talk dis one come still talk say the measles vaccination no be COVID-19 vaccination. Say COVID vaccine no dey for children, but dis measles get vaccine wey children go take to prevent all the bad things wey fit happen if dem no take am. She come still chook mouth on top the Rotavirus wey dey cause diarrhea for small pikin. Say before the vaccine no dey for primary health care and government hospital for Edo. But as e be so, government don provide for am to prevent diarrhea for pikin and dem go start the vaccination for Edo and na 25th November e go start and dis Rotavirus vaccine na free.
Wetin we come do for here today na wetin we dey call stakeholders meeting, meaning meeting wey concern people for this matter, and the matter wey dey talk for here na measles. We no only dey talk about measles, we dey talk about wetin we dey call Rotavirus. Most of us know wetin measles be. Measles na disease wey virus dey cause. E dey affect most of the time children wey dey less than 5 years old. No be say no dey affect adult o, but na children na e dey affect and e fit kill pikin sef. So because of that, most of our mothers those days they know wetin be measles, so no be wetin new. But wetin we dey talk about say for now we dey see many, or should I say small, we say pockets of infection for different local governments. Not be say only Edo State, even surrounding states and even for the country at large. So since we dey get small measles like that, people get infected, and the measles now one be say disease will be say e fit from one person enter another person fast. Either if the person dey cough or through catarrh or the person just dey sneeze. Before you know, if it dey reach 2 hours, another pikin don carry am. Whether for school or whether for church, playground as they dey like that, they go just dey share am. So we don't want something like that because we know say na killer disease. Measles na one of the killer disease for children. So because of that now, government come make and say, oh, more we do measles campaign. Where we say we go dey go round, they vaccinate people for measles. Vaccinate children from 9 months to 59 months. 59 months come be say before 5 years of age. And then they go dey immunize children against these measles. Not be say we go dey go from house to house. Like the way we dey do polio, but you go dey see the one wey they call temporary post. Maybe say they fit your waka reach one market, put umbrella there, stay there for some time. If you see them for there like that, you go carry your pikin go. Not be say, oh, I get hospital when they give my pikin inject. Now the same government people where they give for our health center. Now then you go see for outside where they give measles. So nothing like the one where they market and not like them. We do it like that. Make for be say people where they market where no one come out, they go fit immunize their children. People where they church, it go they make it easy. Everybody go fit get the vaccine like that. You don't need to waka go health center. Of which we know say health center any day, anytime. When you go, you still get your vaccine. As far as you carry your card, follow body. So that na measles matter. So that not talk say, hey, they don't fair give my pikin. This campaign, you make sure you take it. You can't make your pikin strong well. You can't take strong against the measles. So we won't fight for our state. So we won't fight for the entire country. So more we take notes. And I know say people don't they fear say COVID. Nothing do COVID though. As I did, I don't take my COVID-19 injection, the full one up to my booster. But I won't let you know say COVID-19 vaccination, not be children. Now we they give. This measles campaign, may you dey sure say na measles we won't give your pikin. Nothing like say na COVID or they won't give our children. Nothing like that. All these things what they do so now make government bring say make we for take care of our children properly. Make our future for day bright. Not be the one where we say children We know say measles fit cause blindness. Future children go come dey blind. Future children go come dey get brain damage, come dey get effect for hearing problem. We no want all of that. We want healthy children. Healthy children wey go lead to healthy adults. So now make our government, we not the rest, they bring this one come out for us. More we come dey assess, more we take advantage, more we take the vaccine. Then this Rotavirus vaccine, when I say one talk about, that one would introduce them to our routine immunization, meaning say we introduce them to our normal immunization schedule. Before now, we not get Rotavirus vaccine where they give children. That one they drop on for mouth, like oral polio. We not get them before for our primary healthcare center and for government hospital. But you they sell for some private hospital, it did well. But now our government don't make it easy. Say, okay, go primary healthcare center where near you pass. Go health facility where near you pass. Say when you reach there, they go give you this Rota where they help to prevent diarrhea. Diarrhea now when picking they go toilet all the time. Go to all the water, before you know water where their body go finish. They kill children too. So now one of the killer disease, diarrhea. So I beg. Once we introduce them, we introduce them on the 21st of November. If you go any health center, they will give you free of charge. Free of charge. Not be the one you say, oh, you go here, they give you the same, you bring 20,000. All government hospital is free of charge, this Rota. And even measles. So when you go there, they'll give you, go with your Peking card. They will give you, and it will help prevent childhood diarrhea, where Rotavirus they cause. My people now do.
Dr. Amina Yahaya will be the SBC consultant for United Nations Children's Fund UNICEF. Come shook mouth on top the plenty reasons why parents no go want make their pikin get the measles vaccine. Say some of the parents go talk say they no get time, some go say they no hear about am, or some dey fear the side effect e fit cause. She come talk say if any pikin dey react to the vaccine, make dem sharparly carry the pikin go any hospital for Edo. Say dem go sharparly attend to the pikin. She come still talk on the strategy dem go use for the vaccination campaign for Edo State. Come yarn tori people make dem join body with them.
Mass campaign will always miss children on the street. It is not every time we get to vaccinate the total number of children we are expected to vaccinate. And when you ask parents, they will tell you that one, they were not aware of the campaign at all. They didn't know any campaign was taking place. And that is why all of us in the hall today are very, very key in ensuring that we don't get any person in Edo State that will say they are not aware of the campaign. The other one, parents will tell you that the child was absent. I keep on asking these funny questions. We are going to be vaccinating children that are 9 to 59 months. That is 9 months to 5 years. Where do little children go to? That is the question. A child of that age cannot go out by himself or by herself, except with the mother. And the mother is not the same person that will take this child to go and get vaccinated. So what stops the mother from taking this child to get vaccinated? And the mother claims that the child is not around. If the child is in school, we also engage with the school. We vaccinate in the schools. If the child has gone to the church with the mother, we also do church engagement. We vaccinate in the churches. But we still find situations where parents will tell you that the child is not at home. So this is a very big issue. I don't know how you people will be able to help us to talk to parents so that they avail their children for these services whenever we come. The next one is feast posts were too far and lack of information. And this feast post too far, we have been able to work around it. We have taken it actually as an issue because sometimes parents may not want to trek for long distances because of laziness. A lot of people prefer to go out these days only when they are mobile. So we've been able to understand that fact. So what we have done to mitigate against that is to create mobile posts. This mobile post will move from street to street. And we expect parents, whenever the mobile post is in their street, they will be able to access this vaccine in their street. We have town announcers that will be announcing around the street to inform the households that vaccination post is situated in Hajia Amina's house, for instance. And we expect parents to take their children there. Then the last one is lack of information on time and place of immunization. And that is also one of the reasons why we are also engaging so many medias. We are also engaging other means of communication to disseminate this time so that people will know, just like we have told you now, we are starting tentatively on the 15th, which is on Tuesday next week. And we are dividing this implementation into phases. We are going to come to that and we'll let you know. So fear of side effects, of course, for any parent, you want to give anything new. The parent, any good parent will definitely exercise fear that there could be side effect. Somebody once told me that when you drink too much water, that there is side effect. And the side effect is that you will not be able to run, your stomach will be so full. Yes, it is a side effect because it has affected your activity at that very time. But for this campaign, we are saying that there are no side effects because the vaccine is completely safe. But however, when you are introducing anything new to the body will definitely react to it. And that reaction is usually mild. It's maybe mild temperature. Within 24 hours, the temperature will naturally just go. And we advise parents to give paracetamol. Sometimes mild rashes that look like measles may also appear. It is not anything to worry about. But if any reaction comes up after they have taken the vaccines, they should please report to the health facility where they were given the vaccine. A card is going to be issued to them, and on the card they have the name of the vaccinator, the name of the health facility, the type of vaccine, the expiring date, the manufacturing date, everything is there. So they take that card, go to the nearest health facility to complain of whatever reaction that they feel they have noticed. Then another one is mother too busy. Yes, we are also engaged, like I'm here now. Supposing I'm still within the childbearing age and I have a little child, there is always what we call a preference. And most often these days we always prefer our job because that is what brings the 10 naira home that we used to feed. That again has gone to affect the life of our children because we have not been able to find out the best method, the best way to be able to take care of our children's health to ensure that we give them these vaccines, which is very, very cost effective. The inadequate mobilization, some people say because they were not told, they were not aware, they did not know what we are doing. We are doing a lot of work in terms of this adequate mobilization. That is where we have the house-to-house team, we have the town announcer, we have the crowd controller in the team so that they can help us to mobilize at community level for the vaccination. Vaccination campaign strategy. We said the state is going to stagger the campaign into phases. That is, the first phase is going to implement 7 LGs. The next one is going to implement in 11 LGs. Then we are also going to work with teams approved from national and probably additional to be supported by states. Then we are also going to work with only qualified and certified health workers. They are going to be the vaccinators that are going to be vaccinating the children because we know to vaccinate is a specialized assignment. So not everybody will do that except those who are certified and trained. Then the strategy is going to be fixed post and temporary fixed post. The fixed post is going to be in the health facility, while the temporary fixed post are those people I said are mobile that will be moving from street to street. Then cards will be issued to persons vaccinated as evidence of vaccination, which should be kept for reference. Because after we finish this vaccination, another team is still coming again to come and verify, and that is the survey we keep on talking about. That is the post-campaign survey, the PCC. They will come and verify to see what kind of work was done. Was it well done, or was it haphazardly done? Then places like motor parks, schools, churches, malls, marketplaces, etc. will be visited by our teams to see that we adequately cover all the children. Then every child vaccinated will be finger marked, and the essence of this is to avoid double vaccination. So what are our dates for campaign? We will tentatively be starting on the 15th to the 22nd of November. That is in the first phase. Then the second phase will start on the 25th to 2nd of December. And for the first phase, we have Oredo, Ego, Ikobaoka, Oriomo, Nwode, Ovia Northeast, and Ovia Southwest. Those are the 7 LGAs that will be implemented in the first phase. Then the second phase will have Owan West, Owan East, Akoko Edo, Esako West, Esako Central, Esan North, East, Esan Central, Esan West, Igweben, Esan South, East. That will be implementing from the 25th to. So we are also going to be having house-to-house mobilizers who are expected to sensitize households, collect information about the age, the sex, location of the child before implementation and during implementation. Cards issued to children after vaccination should be kept properly by the parents because survey will be done to determine if the state was able to reach all the eligible children. Then town announcers will move from street to street in every community to make announcement on the date, location of the teams, and also to pass key messages. Now, this is where the real assignment is, why we are here. Call to action. As journalists, what are the expectations? What do we want you to give back to us? What do we want you to give back to the society? This is where your corporate social responsibility comes in. And one of the things we expect you to do is to support in non-compliance. You support in preventing non-compliance in schools, communities, places of worship by accurate reporting on media handles. We have known from time immemorial that one of the reasons why we sometimes get non-compliance in schools and all these places mentioned is sometimes because of the kind of news that some of us may carry because we heard so, because they said so and we think so. And at the end of the day, by the time I read it, I will think that it is actually true and the information will spread like wildfire. For instance, a child may be vaccinated in a school A, and maybe somebody else fainted, not even the child that was vaccinated. And the news gets to social media or gets to any other reporter, they could carry it. And it becomes a very beautiful headlines because we know newspapers sell these days because of headlines. Child dies in so-so school as a result of vaccination, and it becomes a problem. So we are begging, we are using this media to tell you that accurate reporting is very, very key. Please verify with us. Before you carry any news, verify with us, check with us for whatever news you want to carry so that we can be able to authenticate it, whether it is true or not.
Esiegbe Efeomo, wey be the State Deputy Director for Disease Control and Immunization for Edo State Primary Health Care, tok say dis measles campaign na for pikin wey dey between the ages 9 months to 5 years as e go protect dem from getting the disease as e fit cause many katakata for dem. E con still tok say for dis campaign, dem go also dey give the pikin dem Rotavirus vaccine wey go remove diarrhea, and dis campaign dey for 2 phases. Say the first phase go start for Edo South for November 15 to November 22, 2022, and the second phase go be for Edo North and Edo Central for November 25 and go end 2nd December 2022.
People, now well done. This program where we want to get so now what we dey call measles campaign, and why we dey get this measles campaign now make we for go out to ensure say all our children wey dey from 0 to 5 years we make sure say they get the measles vaccine so that they no get the sickness. If they get this vaccine, they don't get the sickness. But if they don't get this vaccine, they at risk of carrying this sickness. Where if it cause problem, we be say they know if it grow well or if it go die. You understand? Edo State government don't want to make any children with this state die. That's why they mobilize us to make sure say we reach all villages, all communities, and everywhere to make sure say the children get this vaccine. So we go start this campaign for Edo State from the 15th of November, go reach the 2nd of December. So now 2 phases, now we go to get this campaign. For Edo South, we'll get them from the 15th to around the 22nd of November. Then for the second phase, we'll come start from on the 24th to around this 24th of November to 2nd of December. That one we will come cover Edo North and Edo Central. But we will make sure say all the children, all the villages where they this state, we cover everywhere so that no pikin will get measles for this state. But you get another thing where federal government self come add join the routine immunization where our mothers they go carry children they take for inside clinic. Now it be Rota vaccine. So for this period now we want to do measles campaign, we go to give that Rota vaccine too, so that children no go they go dey poo come lose strength. So once they get that vaccine now, they go grow strong. So for now, we don dey try dey go meet those the authorities wey dey in charge of schools. We don dey go meet churches, heads of churches, religious leaders, traditional leaders, so that they fit explain to our people say this vaccine e dey safe o. Government mean well for our people, and if they get this vaccine, the children go grow strong. They no go sick yeye sickness wey this vaccine for fit prevent, and they go grow strong for us and become future leaders of tomorrow.
Oluwatobi Odeshola, TMC TV News. Make una remember say your PVC na your power. No go sell your vote for any politician or political party on election day.